Julian Assange. You all know he's holed up in the Ecuadorian embassy, but few people will remember why. Julian Assange was charged with non-consensual condom removal, colloquially referred to as stealthing, which is a crime in some Nordic countries, but in very few others around the world. Now, despite widespread public interest in stealthing and current legal debate as to whether it's sexual assault, there is nothing in the literature on how often this practice is occurring. Given that condoms are the primary preventative method to prevent against the transmission of STDs and also an effective form of birth control, it is important we know how often this is occurring in our community. Now, when I found this literature gap, my supervisors allowed me to expand the scope of my PhD to include several chapters on stealthing. So patients who present to Melbourne Sexual Health Centre undergo computer-assisted self-interviewing, and I designed a questionnaire which followed on from this, which asked patients whether they had ever had a condom removed during sex without their consent. During the survey period, 3,000 women and 3,500 men who have sex with men, or MSM, presented to the clinic, and 41% of women and 31% of MSM answered my survey. 1 in 3 women and 1 in 5 men reported that they had had this practice done to them. It was more commonly done in female sex workers. Importantly for our clinicians, 2% of MSM and 4% of women were presenting to the clinic on the day following an episode of non-consensual condom removal. Now, this has implications for patient care because these patients will need to return to the clinic in 6 weeks for HIV testing and also might be eligible for post-exposure prophylaxis, which prevents against the transmission of HIV. Over half the patients reported being emotionally distressed followed being stealthed, and this also has clinical implications as these patients could be offered counselling within our clinic. 5% of MSM and 8% of women reported acquiring an STI following being stealthed, and 2% of MSM and 1% of women reported acquisition of HIV. This data may be subject to some bias though, and we can't validate it. Interestingly, women and MSM were 3 times less likely to consider it to be sexual assault than people who had not been stealthed. And this ties into recent feminist literature, which says that language around sexual assault isn't broad enough to encompass all the varieties of assault that we see within our community. This is the very first study that looks at rates of this practice, and therefore we need further studies to look into how often this is happening and whether we can do anything to prevent it. Thank you.